welcome aboard.
Please welcome to the stage Axios healthcare policy reporter, Peter Sullivan.
Hi, everyone. Thanks so much for being here. I'm Peter Sullivan, our healthcare policy reporter here at Axios and one of the authors of our Vitals newsletter. We're so excited you're here today to talk about the future of Alzheimer's care. Before we start, a quick plug. If you're following on our live stream, please use the hashtag AxiosLive. So without further ado, I'm really excited to bring up our first guest, who is President and CEO of the Alzheimer's Association, Joanne Pike. Well, thanks so much for being with us, Joanne.
Thank you.
So let's start with the science. We now have, a couple drugs now on the market for Alzheimer's. What's kind of lay out the landscape in terms of the treatment options? What's the progress that's been made in the past few years, but also, what do we still have missing that we need?
Yeah, thank you, Peter. This is such an incredible moment within Alzheimer's treatment and research and the progress that we've been making. The pace of that progress has really been increasing over the last few years. But in thinking about what we still need, we also know that the pace of progress is going to pick up given everything that is in the pipeline and the knowledge that is being generated right now. Over the last few years, we now have 2 FDA-approved treatments that treat the underlying biology of the disease, targeting amyloid beta through the monoclonal antibodies. Those have been those first-line treatments that are available. But it's also important to recognize it's not just treatments, but it's the progress in diagnostics as well, where we're seeing progress in the ability to diagnose through blood, which really democratizes the access to an accurate and timely diagnosis for individuals who may have questions about their cognition. It also gives them the ability to access those treatments sooner. But we also know with some of the research trials that are going to be reporting out soon that there is this progress is not only about the monoclonal antibodies for amyloid beta, but we're also looking at other targets, the potential for combination therapy. And so this pace is only going to increase over the next 18 months.
Yeah, that's really exciting. So well, let's go there. I mean, what in terms of things in the pipeline or treatments or other things that are being worked on, what's kind of most exciting to you at the moment, or where should the focus be in terms of research efforts?
There's a couple of things that are in the near term that we know that are reporting out that I think is a lot of excitement building in the next couple of weeks at the Clinical Trials for Alzheimer's Disease conference in the first week of December. The EVOKE and EVOKE Plus trials that are looking at semaglutide, a GLP-1 to treat mild cognitive impairment due to Alzheimer's disease and early stage Alzheimer's disease. That's going to be reporting out. Again, giving us an opportunity to think about another target and what that means for treating those with Alzheimer's. We also know that the potential for a GLP-1 offers a different safety profile. It offers a different clinician path because it is already used today. So it also raises questions for us about how we can ensure the use of that potentially down the road. And another target gives us the ability to think about combination therapy. So there's lots of opportunity with a report out of that trial. And then in the moderate term, we don't know exactly what the timing is. We do know that Trailblazer 3 is reporting out on the use of donanemab in preclinical, asymptomatic Alzheimer's disease, so those who have biomarkers but yet are not showing any clinical symptoms. And then behind that will be the AHEAD 3-45 trial that is looking at Leqembi and the use of Leqembi in that same type of asymptomatic population. So right there we have prevention trials happening to arrest or slow the progression into clinical decline for those who do not have symptoms. We have combination therapy. And then some new news that is coming out that is building on reports that the Alzheimer's Association made this summer is around our own lifestyle intervention study, US Pointer, where we were able to show that a structured, highly accountable intervention at the community level for nutrition, physical activity, social and cognitive training, and medical management of heart conditions can have an impact and slow decline of cognitive concerns over the course of that intervention trial. While we reported out the top line, the first results of that, at CTAD in the coming weeks, we'll be reporting out on some of the ancillary studies related to that as well, some of the imaging that is associated with that lifestyle intervention, sleep studies associated with that as well. So we're really excited to think about all of those key areas that I just mentioned, but also how does lifestyle impact cognition, Alzheimer's disease, and other dementias?
Yeah, that's really interesting, particularly on the GLP-1. I mean, I feel like a lot of people wouldn't think of that, being useful here, but it could be. So let's shift. I mean, we're in Washington. I mean, there's been a lot of turmoil particularly at NIH in terms of canceled grants. How has that affected their Alzheimer's work, do you think? Are you worried about that? Or is the Alzheimer's piece of their work continuing okay? Or
well, we do know, and this is a big part of our advocacy efforts. Over the last decade, the Alzheimer's Association, through our advocacy efforts, has been able to increase the base funding at the National Institutes on Aging from around $400 million in Alzheimer's and dementia research to where it stands today at $3.8 billion. So we know that there has been some changes. There has been some impacts on the types of grants. We and our advocates certainly want to make sure that that $3.8 billion is held steady. But not only that, we're also seeing signs that with the professional judgment budget of an increase of around $178 million for the next round, that we are seeing some positive signs that will be included within the Senate and the House budget as well. So while we want to make sure that the $3.8 billion base is protected, we also know that this is a time to accelerate. We cannot slow down. And so continuing the increases within the Alzheimer's and dementia research budget is incredibly important. I want to just address one thing, though, as part of that, and that's what does NIA and NIH fund within Alzheimer's and dementia research? Because I think some inaccuracies have been portrayed within that. In the last decade, NIH, in the most recent reported analysis of what they fund, has only funded less than 14% of their treatment targets in amyloid. We know that NIH, NIA-related activities have a broad spectrum of what they are funding for targets for Alzheimer's, and so we are not seeing a bolus that is not impactful, because the facts are that NIH is funding a broad range of targets beyond amyloid.
So in terms, you mentioned obviously NIH funding. I'm sure that's a big priority. What are your other kind of big DC priorities? Is there action Congress needs to take more, or you'd like to see from the administration?
Yeah, there's two big legislative priorities that we have in front of us right now, really associated with how can we ensure that all of the progress that we are seeing come out of the pipeline, all of the innovation, can reach communities and can be delivered with that promise of the intention of impacting lives. One of those is the ADAPT Act, where we're looking at providing grants to physicians for education. Some of that education could be for things like Project ECHO, where we're training our physicians on diagnosis, care, and treatment opportunities for Alzheimer's and other dementia. The other one that we have a priority on is called ASAP, and it's really looking at how can we create the mechanism for coverage through Medicare for some of this new innovation, especially around diagnostics and blood diagnostics in particular.
So also in terms of the administration, I mean, obviously RFK is now there as HHS secretary. You mentioned maybe some controversy around the amyloid pathway. How have you kind of viewed his tenure in terms of Alzheimer's? Has that been an obstacle? Have you been happy with the way he's been handling that issue, or how do you view it?
Well, right now we know that that $3.8 billion is certainly still in effect. It's still in circulation. It may not be funding the same projects that it was a few years ago. That is an incredible commitment to continue, and we want to make sure that it continues to grow over time. The piece is that we want to protect the broad spectrum of the research that is happening at NIH, NIA to look at targets, but also diagnostics and care models right now.
Got it. So let's shift to, maybe for the daily experience of people out in the country. I mean, as we're getting these new advances, for example, for primary care doctors, I mean, do you see a shift there in terms of early detection? Are there more things that the average person should be aware of, they should be talking to their primary care doctor with, especially as they get older?
I think one of the things that we have learned over the last few years is that individuals who have seen changes within their own cognition are increasing their ability to have that conversation with primary care. What we want to also make sure is that primary care feels confident in their ability to address anyone's concerns that they're bringing, and that they are proactively talking with their patients and their caregivers that are coming into the office about some of those cognitive concerns. We know based on our own surveys that confidence is not as high as we would like it to be. And that's why, when thinking about what can we do from a legislative standpoint, ADAPT Act is such an important piece to any of the innovation that is coming, so that we know we can support the physicians and the health systems in advancing this knowledge base so that individuals are able to receive the care that they need, especially given some of the advances coming out of the pipeline. But I think treatment and the advances that we're seeing also result in people having more confidence, more interest in learning about those things. So we are also seeing more individuals going in to have those conversations, to think about what diagnostics mean for them, and then to have the ability to make a choice about whether treatment is the right decision for them.
Yeah, that makes sense. And also in terms of, the experience of patients, I mean, there's been some discussion around, the price of some of these drugs. Have you been hearing from folks that, there are price barriers sometimes to these treatments, or has insurance coverage been, sufficient around them, or how do you view that kind of discussion?
Yeah. Right now, and certainly we have worked over time to ensure that Medicare coverage was in place for treatments as they came out of the pipeline. The other side of that, though, is the private insurance sector. And while there has been some pickup in coverage on that, we also know that there is an important area within that to work on from the private sector covering treatments and diagnostics. But you highlight an important piece, which is as we're seeing diagnostics that are available, that are more accessible, that can be used at a community level and really democratize access, we want to make sure those are covered as well. And that's the important work of the ASAP Act that will be a big priority for us to ensure that coverage of diagnostics as part of that journey, that treatment journey as well.
Yeah, so maybe let's close out with maybe some more practical side. I mean, is there something people can do, or that you do, in your life that can, benefit their brain health? I mean, are there maybe some of these are wrong, but you hear these myths about, you should do brain teasers or puzzles or something, and that will help you. I mean, what should people be doing, if anything?
Yeah. Well, I think what we learned with the U.S. Pointer study is that accountable behaviors and group settings are an important part of aging and cognition. So ensuring that the nutrition that we know works, the MIND diet, along with physical activity and social connection and engagement, cognitive engagement, along with taking care of your own heart health is truly important within that. So think about the ways you can empower yourself, ensure that your blood pressure is under control, make sure that you're getting your steps in every day. Here in DC, it's easy to do to walk between sites around around the city. But the other key piece is some of the things that we're going to learn coming up at the CTAD conference around the U.S. Pointer study and things that could have benefit. And we know already exists from just a population level, but now an intervention level, sleep, and what does that play for you? I mean, I know personally there's two pieces within that I spend a lot of time with, and that's my steps, my physical activity, and also my sleep. I've become fairly rigorous about my own sleep health, but we'll learn more on that front soon.
That's good. Sleep is always good. Well, I think we're going to have to leave it there on this one, but thanks so much for joining us.
Thank you.
Introducing our View from the Top moderator, Ryan Heath.
I'd like to invite to the stage Candace DeMatteis, who is the Policy Director at the Partnership to Fight Chronic Disease. Welcome to the stage, Candace.
Thanks, Ryan.
Now, I am so grateful that so many of you have come out early this morning. Alzheimer's is an issue close to my heart. I'm sure it is for many of you, given how prevalent it is out there in our communities. And we could not do events like this without partners like the Partnership. So I'm just really honored to be here chatting with you today, Candace. Now, chronic disease is the #1 cause of death, disability, rising healthcare costs. Can you please tell us about the Partnership and why you've decided to make Alzheimer's a specific priority?
Sure. Well, as you mentioned, chronic disease, it affects 1 in 2 U.S. adults. More and more children are affected by chronic disease. And a lot of that is preventable. We have interventions that also help to reduce the complications that drive costs and affect our quality of life and our length of life. So the Partnership is a broad coalition really focused in on that, as our name implies. So for Alzheimer's disease specifically, it is a devastating disease. It is so costly. It has impacts not only on the individual, but the family, the community, employers, and obviously the nation as a whole. There's so much unmet medical need, but as Joanne talked about, there's a lot of excitement, there's a lot of advancement. We know more than ever, and we're really starting to be able to make a difference. So that's why the focus there as well for PFCD, and me as well. You mentioned you're personally affected, so for me it's a professional interest, but I also have it in my family and am dealing with it presently with loved ones, so it's a personal passion as well.
And we heard some good news from Joanne in the previous conversation, progress. But what's your take on, what's the score when it comes to progress in both diagnosis and treatment?
So we just finished the World Series, which was fantastic for those of you who watched. So I like to use a baseball analogy. We're finally in the ballgame. We're finally at bat, and we're getting base hits. Alzheimer's disease was first named and diagnosed, if you will, over 100 years ago. But it's only in recent years that we've actually had FDA-approved treatments that interrupt the progression of disease. We now have blood-based tests to allow us to detect it at a preclinical stage. And ideally, and there are clinical research ongoing to intervene at that early stage. And that's really where we're going to see big differences. Yeah. So I know some people are critical because they want that home run. It's, we're all eager for the cure, the thing that stops it in its tracks so we don't have to worry about it anymore. But it's so important to recognize how far we've come, the decades of experience that have led up to this, the billions of dollars that have been invested to get us to this pace, but that pace is accelerating, and we are moving forward. So it's a really exciting time for Alzheimer's disease. We just need the policy, candidly, to keep pace with that.
Well, I'm honestly glad you mentioned that, because we could get the silver bullet on the medical side, but there are still going to be barriers for both patients and caregivers. It's policy, it's how the individuals are aware and how they take responsibility for their own situation. What are some of the biggest barriers that patients and caregivers are facing that you want to see removed or reformed?
Well, the first one I would say is just getting rid of the idea that dementia and, it's like, oh, it's just forgetfulness, or that dementia is a normal part of aging. It is not normal. And so if we can get rid of that myth, then people can seek, like, hey, something's going on here. I've noticed something. Let me get checked out. Yeah. So that's the first major hurdle. And then the other is, we have shortages in the healthcare workforce. Joanne mentioned the ADAPT Act that would invest in the dementia care workforce to be able for people to have access to specialty care, but also at the primary care level to understand what we're looking at. And then there are also coverage gaps that are really important. People are diagnosed earlier. There's early onset Alzheimer's for people who aren't at Medicare age yet. There is legislation in the works that would accelerate the time from being diagnosed to being able to get Medicare coverage, which again would provide that access. So there are a lot of opportunities, and unfortunately those barriers need to be overcome so people can have early access and get diagnosed and treated.
And could you give us a sense, or if you even have specific numbers around sort of what are those delays between understanding there's a problem and getting treatment, or how many people are not getting access to the therapies that would really like halt or slow this at the early stage? Because, let's be real, that's what would save a lot of pain and a lot of money if we could mobilize ourselves towards that sort of situation.
Sure, no, it's a great question. We know that today alone, 3,000 or more people will progress beyond the reach of these currently FDA-approved treatments. So they may have mild Alzheimer's disease, and once you progress to moderate or even more advanced stages, these drugs aren't labeled for those advanced stages. So that's huge. So time is clearly important, but because of workforce barriers, because of stigma, because people don't accept that this isn't normal, any kind of delay like that delays the reach of these treatments and is really, really tragic. And then facing coverage barriers as well can be really difficult.
Yep. So, I look across this room, I know some of you are new to me, but it's a formidable audience. We've got advocates, we've got medical professionals, members of Congress even. So as you sort of think about that audience, what would you request their help on? What do each of us in this room need to think about, whether it is something aimed at HHS, at CMS, somewhere else? Like, what are the requests that you have for folks here?
Well, as I mentioned, the pace of innovation is really accelerating quickly. We need policy to keep pace. And a lot of that, we mentioned several bills. Joanne and I both mentioned the ADAPT Act, ASAP to make blood-based biomarkers more available and coverage under Medicare. We also have a coverage policy in Medicare that is limiting access. It was an unprecedented decision called coverage with evidence development, first time ever applied to not just to any FDA-approved drug for its intended and labeled use, but a whole class of medicines. So that precedent may affect future therapies as well. It requires, you're not covered unless you participate in a clinical study under Medicare, so that restricts access to.
But that's really hard for a lot of people.
It really is. I can give an example. My mother was diagnosed with Alzheimer's disease. For her, it's a 3-hour drive to get treatment. These infusions are, one of them is once a week. She just decided, no, I can't do that. So to find a provider that was participating in the registry in the clinical study, and she lives near an urban area in North Carolina. So can you imagine if you're in Wyoming or somewhere that's even more rural? These are real issues that people are facing. And so as that paces, there's a lot of excitement, but we need that urgency. I mean, all of us are affected. If you don't have a personal loved one who's affected, I mean, we're all getting older, so our risk factors are going up. So we need that urgency to, from the Hill, to push back on the administration to get them moving, NIH funding, Medicare coverage, and the like. So there are really a lot of opportunities.
Yep, and a lot of work for everyone.
Yes.
To do. You kind of touched on it there, that this, in a sense, what we do with Alzheimer's can set a precedent for other conditions. Sort of, what's the best argument there that people should keep in mind? So even if you're not personally affected by Alzheimer's, why do we have to get this moving now to make sure that we can support other conditions going forward?
It's a great question because with that precedent that I was talking about with Medicare coverage that covers with evidence development, there are kind of a little bit of dubiousness in terms of whether CMS even has the legal authority. That has not been litigated yet, so stay tuned there. But there is an opportunity for Congress to step in and the administration to step in, Congress to push to reverse that policy and the administration to then reverse that policy. But where the challenge comes in is it would allow CMS, if they feel like they do have this authority, to do it to other treatments, to do it to all future Alzheimer's treatments, potentially, God forbid. But other neurological conditions, cancers, I mean, any number of different things. Yeah. The other thing that the CED did was cast a shadow over the FDA's accelerated approval pathway. And that accelerated approval is a pathway that is written into law, and it focuses on diseases that are serious, often fatal conditions for which there really are no or not very good treatment options for people. And it accelerates the access, patient access, and FDA approval. It doesn't change safety. Safety is still the same. It just uses a surrogate endpoint instead of the final endpoint, and clinical trials continue. But patients have access because they are living with very dangerous, serious diseases. CMS under the CED policy said if you want coverage under Medicare for that, an accelerated approval drug within this class, you have to participate in a clinical trial, which means literally you could be randomized to placebo. You're paying and you think you're getting treated and you're not. I mean, if you talk about you've got a fatal illness and you may be receiving a placebo, it's just untenable, really. Yep. So that's another area that we would like to see, Congress step up and say,
Yeah, and I mean, I hate to mention it because cost is often such an issue around healthcare issues, but one other untenable aspect is sometimes the cost, like $10K a month for ordinary care, $15K a month for memory care sometimes. How have you seen that changing over time? And is there anything in particular we need to keep in mind about those cost factors?
Absolutely, it's a great question. One thing that I think anyone who's lived with a loved one with Alzheimer's disease knows how expensive it is. And that's usually on you. That's on the family. That's on the individual until you spend down and qualify for Medicaid long-term care. As you mentioned, long-term care, regular long-term care is $10K a month. Memory care is 50% more than that, $15K in our experience, and in some parts of the country even more. So those are borne by, they tend to be borne right now outside the medical system. And anytime you have a new intervention, where before it was the family's taking care of the person and then, they become more and more disabled and then pass, those costs are not within the healthcare system. So anytime you have an intervention that shifts to the healthcare system and people, it's too expensive, we can't afford it. Well, families have been dealing with it for decades. And, so it's important to recognize that, yes, cost is so important and it's critical to look at things. We want things to be accessible, we want things to be affordable. But when you're looking at the price that families and the cost that family caregivers and others are carrying, and a lot of uncompensated care as well, shifting that and being able to delay progression is so critically important and so valuable to those people.
Candace, thank you so much. You've given us a lot to think about. I believe in all of you. We all have the capacity to go and make some useful changes based on this information. Thank you, everyone, for listening, and thank you, Candace, for sharing that.
Thank you.
welcoming back to the stage Peter Sullivan.
Thanks. I'm back. So our next guest was not able to be here in person, but we're excited through the wonders of technology. We're going to have a video of our taped interview that we conducted yesterday with Congressman Vern Buchanan, who's a big leader in Alzheimer's as well. And then after the video, I'll be back out in person with our final guest right here on the stage. So without further ado, here's our taped video interview with Congressman Vern Buchanan. Congressman Buchanan, thanks so much for joining us.
Well, thanks you, Peter, and your organization. You guys do a lot of great things up on the Hill.
Yeah, so there's a lot going on Alzheimer's these days, and I know that's a subject you're very active on. So maybe let's just start kind of generally there. What do you kind of view as the next steps for Congress in the Alzheimer's space, or any legislation that you're working on in that area?
Well, let me just say up front, my passion for this is because my father, at a young age, 58, has one of 6 kids in a blue-collar family. We found out he had Alzheimer's, and then that took us to working closely with him and a nurse and everything. So he ended up moving into our house for 10 years. So I know the impact of caregiving and what it costs, the time and money it talks to take care of a loved one. So that's a lot where a lot of my passion is. There's a lot of heart-related issues and cancer, but Alzheimer's has been at the top of the list for me.
Yeah. So how do you see, is there room for Congress? Does it need to work on Medicare coverage of certain areas? There's been some debate around that in the past, whether it's drugs or even the tests that are needed to know that you have early Alzheimer's or something like that. What's kind of the legislation that you're working on?
Well, I think the big thing is the potential to be able to take your blood and figure out exactly where you're at. There's also a lot of capability in terms of drugs that are available today. People are taking advantage of some of those. So there's a lot of movement on a lot of different fronts. We're kind of can't wait to get back, in a sense, to Washington. I mean, it's nice outside, sunny, but the bottom line, we need to be up there working together. And I've got a great co-leader on this piece of legislation, which will basically make a big difference in that space in terms of preventative. And that's really my whole thrust, and what I try to push is it's all about prevention. It's about trying to deal with a problem before it becomes a serious problem. And there's a lot of things in that area that are capabilities that we can work with.
Yeah. No, so now, I mean, in the past few years now, we've seen some drugs, treatments for Alzheimer's for the first time. There's also been some debate around the cost of those drugs, the efficacy of them. How have you kind of viewed that whole debate? I mean, is this a promising sign that we now have these drugs? Is there more to be done around the cost and access to them? How do you view that?
I think there's a lot of people that, we got to work on 2 parts. One is the research and a lot of the effort that's being done in that space. And it's very, as you mentioned, a lot of it's pretty promising in terms of the blood, being able to analyze someone's blood work and some different prescriptions that can make a big difference. But that's where the thrust needs to be. There's a lot of people that are impacted in terms of the numbers. I brought it, but I think just in terms of Florida, it's 580,000 people are challenged with Alzheimer's, and Medicaid just in Florida is spending almost $4 billion a year. So that's one part of it, but we'll figure out the money part, but let's try to do everything we can to make a difference and give people some hope. And I think these are very real opportunities.
Yeah. Yeah. So on that front, I mean, we're still looking for, that true cure for Alzheimer's. That's NIH has a role there. There's been obviously some turmoil there around canceled grants at NIH. Has that worried you at all, or do you feel like the Alzheimer's research part of it is still on track at NIH? How do you view their work?
I'm optimistic. They're doing a lot of work, but these things are bipartisan. And I probably passed a lot of different bills up in Washington, but you got to have a bipartisan willing partner. And there's a lot of people that are enthusiastic about kind of where we're at, but more importantly, where we can be. And we're going to just continue to push as much as we can. We got a bill we want to introduce as soon as we get back to Washington with a co-partner on that, a Democrat from New York. So we're going to make what we really want to weigh in and make a big difference. But again, we're working closely together with the other side.
Yeah, maybe talk about that a little more. I mean, obviously, there's a lot of partisan battles around healthcare these days on the Hill. How have you viewed, how has Alzheimer's been able to break through in terms of being a bipartisan issue? How has that helped? Can that help get this legislation you mentioned, actually across the finish line? Do you see a path to marking that up in Ways and Means or getting that signed into law?
Well, that's something we're going to clearly focus on, but I did want to mention one other thing. I'm all about prevention and exercise. I think that goes a long ways to minimizing a lot of these chronic diseases. And so that's something we're going to continue to push very aggressively. There's no question they've done research that'll make a big difference. A lot of the food that we eat is not very nutritional, and that's making a big challenge for a lot of people. But I think, again, on the concept of the bill that we're going to try to introduce as soon as we get back and they open up the government again is on the idea of taking someone's blood and having being able to evaluate that and see if they have a issue or not, and try to catch it in the very early stages. It's all about screening. From my standpoint, the way I see it is what can we do to find out early and not late. It's being proactive and not reactive. And I tell people you need to be the CEO of your own health and take that seriously. But there's a lot of areas we can work in, and this is an area on prevention, food and exercise and diet, and make a big difference.
Yeah, that makes sense. And that bill would be to provide Medicare coverage of those blood tests, essentially.
That's our goal. Initially up front will probably be a fight, but we'll find a way to get it done. I feel pretty confident. We have a lot of people on both sides of the aisle that want to weigh in and make a difference, because everybody's been impacted by it, like I have, or maybe it's not an immediate family member, but it's somebody else that they know of, a loved one or a good friend or something like that. But this is curable. I'm hopeful, and we're going to keep pushing it very aggressively to make sure that happens and becomes a reality.
Yeah, that makes sense. I guess while I have you on the healthcare subject, I mean, obviously right now with the shutdown, there's this fight over the Affordable Care Act subsidies, extending them. How do you view that issue? I mean, do you think there is some chance of extending those subsidies, or what's kind of the state of play on that?
I wish that we would got this and been dealing with this 2 months ago, because I think there is some way we could have tried to work together and get something done. We needed 6 or 7 more Democrats. It's the way it's normally worked. But I feel very optimistic that if we maybe get back up next week, there's some sense it might happen that way with other things being taken care of. So, but we need to get this addressed and addressed quickly.
Yeah. Yeah. Is there other, work coming up, once you get back, that Ways and Means is going to be working on in the health space, whether it's on Alzheimer's or other issues, or that you would like to see it work on? I mean, it seems like there could potentially be some sort of end of year healthcare package if that comes together.
Yeah, we're looking at that, but our whole focus right now, or a lot of our focus, is on Alzheimer's and trying to make a big difference on that. And I want to do that in the next couple of weeks. We've got a bill written up, drafted, ready to go. We just got to get the government back open. But again, that's our main thrust today. The things that we're trying to look at and want to make a difference to weigh in on a bipartisan basis. But I'm excited about the future.
Yeah. Well, thanks, Congressman. I think we're going to leave it there, but thanks so much for joining us today.
And thank you, Peter. We appreciate the opportunity. We'll see you shortly.
Great. Okay. We're back in real life now, and really excited. Our final guest is a big leader in this space, who we're really happy to have here on the stage this morning. So here is New York Congressman Paul Tonko.
Hey, Peter.
Congressman, thanks for doing this.
Good morning.
Yeah, so I mean, maybe let's just start kind of broadly. I know you do a lot of work on Alzheimer's, but how did you kind of get interested in this issue originally, or what kind of got you involved?
Well, with the numbers that are involved nationally with the impact of Alzheimer's, some 7 million people suffer from the disease, and that tells me that there are just absolute no boundaries. So it's very much assumed that there are family members and friends that have been impacted. Case for me, aunts and uncles that have suffered through this disease. Just remind you that there's a double whammy here. There's an impact of the diagnosis and then finally the loss of a person's identity because of the destructive nature of this disease. And it just motivates you to address this from a humanitarian perspective. For those who don't see it through that humanitarian lens, economically it's going to bust the bank, break the bank because of the numbers, again, associated with the disease and the impact on our budgeting and our economy. So, it just behooves us to do everything we can to move aggressively, effectively, to address policy-wise all that we can do for Alzheimer's.
Yeah, so let's go there. I mean, what do you think the next steps, or what are your priorities in Congress in terms of legislation around Alzheimer's?
I'm thankful for the Alzheimer's Association, the work that they do. I saw Joanne just recently and got to thank her for her leadership. But, championed a number of their legislative items. When I got here, I supported the Alzheimer's plan legislation that would require us to put together a plan that then targeted 2025 for all sorts of coordinated efforts with federal agencies and making certain that we focus on better diagnoses, earlier diagnoses, and an ultimate cure. So, I thought it was a very noble plan, ambitious plan. I have been involved with the reauthorization to 2035, recent success in the legislative arena. But now it's going towards some of the blood-based biomarkers that need to be addressed. I think Medicare coverage for those tests are important. They address the Alzheimer's-related amyloid pathology, and it's important for us to have that science-based approach. So I think coverage is something that we need to work on. Research, working to fund fully the BOLD initiative, which is a focus on research, on caregivers, and on better outreach for diagnoses. That needs to be better funded. And I saw your interview with Representative Buchanan. We're teamed up to do a bit of legislation that is acronymed ASAP, and the Alzheimer's Screening and Prevention Act is all about putting together an effort to, again, fund those efforts for those blood-based biomarkers so that we can rule out Alzheimer's for patients that are so designated by that biomarker discovery. So, a lot that we can do. It still focuses, though, on research. I see the draconian cuts in this budget, cruel cuts, unnecessary cuts that impact on the science-related efforts that we should make on investing in research. The research component here is incredibly important. When you impact HHS with a 40% proposed cut, that means centers like the CDC and the NIH will not be as strong a partner as we need them to be. So, as an engineer, I believe in science, I support science, and as an advocate for Alzheimer's patients and their families, their caregivers, I will do everything to help avoid those cuts.
Yeah. So on that front, I mean, even there's the proposed cuts, but we've already seen, I mean, the administration just unilaterally canceling some grants, changing things at NIH. Does that worry you? Have you felt like that has affected the Alzheimer's research going on there? Has it mostly been in other areas, or how do you?
No, absolutely. I have seen I have seen situations in New York's 20th Congressional District that I represent, the Greater Capital Region in upstate New York. And there are firms, there are organizations that are depending on federal flow of revenues for their research. They've made great strides in cancer, in Alzheimer's, Parkinson's, and macular degeneration, the groups that I visited in my district. You don't just flip a switch and turn research on and off. You're going to lose some very valuable research people who will search for other employment. You have, developments, Petri situations where you're growing the necessary infrastructure for this genomic discovery. So we need to make certain that we fight these cuts. And I can relate that to the fervor I'm feeling right now in the immediate sense of SNAP cuts for nutrition. Yeah. There are people storming mad who are calling the office, who are doing all sorts of rallies in the district, because these are cruel cuts. They're unnecessary cuts, and we need to make certain that the humanitarian approach is what should guide us here. And for Alzheimer's being our most neurologically impacting disease, we developed that national plan. I think it's very important. And I have taken that whole concept and overlaid it onto Parkinson's, which is the second most neurologically impacting disease. And we have now a national plan for Parkinson's. Again, the epicenter of which is research. So this is a very aggravating and upsetting cut because it impacts millions of people, 7 million in the Alzheimer's space, 1 million people in the Parkinson's space, and we can and we must do better. This is failed leadership from my perspective.
Yeah. At least in terms of the congressional role, what's appropriated, this is a bipartisan issue. We just saw Congressman Buchanan.
Absolutely.
Do you think that will insulate, like the president's proposed 40% cut to NIH? It's probably not going to happen, right? Or do you worry there would be some cut through Congress?
Well, I would hope there would be no cuts in the efforts to cure these major diseases that, again, are a huge impact on our federal budget. So if you can't relate to the humanitarian, if you cannot relate to that humanitarian aspect, at least see it as a fiscal consequence that needs to be resolved. But I think the whole fight here over the budget, over the CR, the continuing resolution, is about healthcare. It's about affordability. It's about hope. And I think that we need to be those agents of hope. When I talk to families that are impacted with Alzheimer's and Parkinson's, they are just pinning their hopes on research. And when you pull the rug from under research, you're destroying that fabric of hope that so many are clinging to because they deserve the respect. The American intellect is better than any. I would compare it to any nation out there. We cultivate an environment that grows researchers. We need to reach to them and allow them to do their thing. And to artificially suspend that and cruelly propose deep cuts is just not the solution here.
Yeah, so let's shift to, we talked a little earlier in the program about there aren't some now drugs available for Alzheimer's. Not cures, but there's also been discussion around sort of the cost or the price of those drugs. How do you view that as a problem? Have you heard from constituents who have trouble affording these medications? Is there, on Energy and Commerce, you worked on the IRA, which has Medicare price negotiation. Is there a role there for that?
I think there is a role for government, but it continues to rely on research. So as we develop more and more opportunities, I think it's one of the benefits that have come from the Alzheimer's plan legislation that is now several years old. It has enabled us to take that count of many agencies in the federal layer of government, to bring them together in a collaborative and to network, as we did with the Accountability Act for Alzheimer's that I championed. It requires us to rely on science-based discussion, scientists recommending budgeting and priorities rather than political forces. These people are the clinicians that know best what should happen. We also incorporate patients and family members into that, and caregivers into that whole environment of accountability that guides the budget process. So there are efforts that we can make through the various agencies and develop the pharmaceuticals And again, addressing the cost of those efforts will fall on Congress, where we can offer some sort of relief. And with the supply and demand relationship working itself through, I believe there's a hope there, but we've got to get that discovery investment so that the genomic breakthroughs are there.
Yeah. So you obviously brought up, we're in a shutdown right now. A lot of that is about healthcare issues, the Affordable Care Act, subsidies. What's your sense of the state of play? I mean, is there a chance of extending these subsidies? Do you to vote for a CR, would you need something, concrete on those subsidies, not just a promise, or where are you?
Well, I've communicated to my district that I see the CR debate with two major dynamics, the confluence of which are holding us up in the process. The first is affordability. And if we take a deep breath and step back and look at the events of earlier this week, I think there were record numbers showing up speaking to affordability. People cannot afford to live, many of them middle income Americans who cannot balance that budget. Cost of groceries, of housing, of utilities, of healthcare are draining their budget. So affordability has got to be addressed. So those subsidies are important. But the other dynamic of which I speak is lawlessness. You cannot continue to have this impoundment of funds that are agreed to in a bipartisan, bicameral way, and then have the executive branch scoop those funds and put those funds toward his priorities. And so that rescission making, those measures that rescind of the bipartisan discussions and determinations needs to be addressed in this CR. This lawlessness, this investment of more power in the executive as the majority bending its knee to the executive is not what our framers and founders were thinking. So we have that check and balance of the different branches of government. We need to maintain that. We need to make certain that if we have huge investments that we determine between the houses and parties that go towards Alzheimer's, that effort ought to be maintained and not denied and disrespected by the executive branch.
Yeah, well, thanks so much. I think that's it for us. We're going to leave it there, and that's it for our program this morning. Thank you all so much for coming. Please keep following our healthcare work at Axios.com, and we'll see you at a future Axios event. Thanks.
Peter, thank you.
Thank you.
Thank you.